Hey there, I'm Dr Camilla Cameron. I've been a doctor of traditional Chinese medicine since 2001, and I've been a vagus nerve stimulation expert since 2018. I've conducted over 6,000 vagus nerve stimulation treatments within my clinic, and I've sold over 1,000 vagus nerve stimulation products throughout the world since then. I have created this program in order to provide the most comprehensive program in the world for vagus nerve stimulation. One of the things I promise is great after sales service. So essentially, I want this to improve your health as much as it possibly can. So to do that, one of the main things we need to get right is the clip placement. And that's what today's video is all about. So it's really important that the clips are in the most highly vagal innervative points within the ear. So I'm going to show you how to do that. It's really simple. Once you've done it a couple of times, it'll be second nature. So let's get started. First things first. One of the most important things when you're doing vagus nerve stimulation is to ensure that you're getting great conductivity at the site of the clip. And one of the things to ensure this happens is your gel. So your gel is really important. Without gel, there's definitely less conductivity. In fact, a lot of machines won't even work without the gel because they're not reading that there's any conductivity at all. And also the other thing without gel you'll find is it's really super uncomfortable and an unpleasant sensation. So gel gives us two benefits. One is improves the way the treatment works, and the other one is makes it feel much more comfortable. So let's show you how much gel you need. So you don't need to worry too much about it in terms of how much you're using. You just want to make sure there's enough on there. So that's about the right amount there. So any less than that probably isn't enough. People always ask me, do we need to have it on both sides of the clip in terms of the pad and this bit here? No, you don't, but you probably will end up having it on both sides because I will always close it before I put it in my ear, for example. So it doesn't matter if it gets on both sides, but you only need it on the pad side. Now that we've applied the gel, we're ready to put the clips in the ear. So we are using the part of the ear that's what I call the internal part of the external ear, which is also known as the concha of your ear. And you can see this lovely diagram of my daughter's ear here. We have this line. See, I have a little bit of a line. She's got a much better line that kind of cuts that concha in two. And we have the upper and the lower part of the concha, which is what we're focusing on today when we're doing this clip placement. There are a couple of important things to remember before we put the clips on. The first thing that I'd like you to remember is that both ears should always be the same, in that I like to just do a red clip on the bottom and a black clip on the top on both sides. That's pretty much what I tell everyone to do, but you can do black on the bottom and red on the top, but let's not confuse it. So we're going to do a red clip on the bottom and a black clip on the top. So as you can see in this diagram of my daughter, we've got the red clip placed below the crux of helix, which is that division that we were talking about. So we're now going to the lower part of the concha. So I'm going to put it in my ear so you can see how to do it. So we're going to open the clip up. We're going to place the clip essentially around the ear. So we've got the pad on the inside, and we've got the flat bit on the back of my ear. So you can see that it's placed nice and easily. So we just open it up and put it around the ear and down in that lower part of the concha. Like all anatomy, we all have different ears. So how it will look in my ear might be a little bit different to yours. I would say I have a pretty average size concha. So I do find if you've got an average to small size concha, it's easier to get the placement exactly right because you don't have a lot of room to move in that space. So essentially you're just going to put the next clip above it and you're going to get it right. And that would be 90% of people. If you have a very large concha, you're going to probably have to be a bit more conscious of making sure that your red clip is down the bottom and that your black clip is above that crux of helix. So if we go here and just clip it on there. So you can see, if you look in my ear, really they're pretty much next to each other and I almost can't get it wrong. So we're doing that same thing. We're doing the opening the clip up, putting it around the ear so that the flat bit is on the back of your ear and the padded bit is in the inside of your concha. In saying all this, if you get both clips inside your concha, you're going to get it right. It's not absolutely like, surgical that you need to be above and below that crux of helix. Some ears just won't give you that ability because maybe the top bit's really quite small and you're going to have to sit on the crux of helix a little bit. That's all okay. This is a really high vagal innervation area, the concha. And so if you're getting 2 clips in there, you're going to be stimulating your vagus nerve no matter what. I really hope that helped you understand where to place your clips. I find a video is way better usually than just static images to help you understand that placement. So you've now worked out how much gel, where to put your clips. Now what you have to do is actually stimulate your vagus nerve on a regular basis. I will have sent you your protocols, which will include the settings you're going to use, how often you're going to do it, and how long you're going to do it for. For vagus nerve stimulation to work, you have to use vagus nerve stimulation. The more consistent you can be, the better. Thanks very much and happy vagus nerve stimulation.